Good morning, everybody. You're very welcome. My name is Professor Ivan Keogh, and on behalf of my co-organisers, Tony O'Connor and Dermot Coughlin, I'd like to welcome you all to the Aula Maxima at National University of Ireland, Galway. You're very, very welcome. And for our visitors, particularly for those from America, it doesn't always rain in Galway. So you're very welcome. And it's great to see so many people here this morning. And I just want to tell you a little bit about how this conference came about, and just give you a little bit about the background of it. Just under a year ago, Tony and myself met Dermot, and when I met Dermot first, it occurred to me, well, what could an economist possibly know about head and neck cancer? And about 2 hours later, after one of the most intense conversations I've ever had in Mr. Waffles, which is a coffee shop across from the hospital, Dermot brought home to us that we actually shared a common aim. And the common aim was to raise awareness about head and neck cancer, because all of us that are involved in the care of patients with head and neck cancer in this country realize that there's a very, very low level of awareness. And we wanted to raise this level of awareness and tell people about head and neck cancer and put it out there and get people talking about it. So we decided to arrange this conference. And what we did is we said we target the best. We target the best nationally, and we target the best internationally. And so when people started saying yes, they would come, we actually couldn't believe it. And we felt that we had the makings of a very good conference where we could share information. So for me, I'd really like to welcome and thank our expert panel, or our speakers for traveling from all over the world. You're very, very welcome. And we appreciate you taking the time out and coming to Galway. The other thing that we were very fortunate with was that this conference has been supported by a Health Research Board grant, and that made a big difference for us. So part of that grant is known as a KEDS, or a Knowledge Exchange and Dissemination Scheme, and that's what this is about. It's about bringing people here, about talking about head and neck cancer, about exchanging information. We're talking about the island of Ireland, and and I'm delighted to see so many people here from Northern Ireland, and we have people from Wales and the UK and America, and it's fantastic. And so what we set about, we have been interviewing, we're rolling this as a live webinar, we've been tweeting and twittering and doing all sorts of things. And if you want to ask Dermot, we may even be trending later on, and I'm not exactly sure what trending is, but perhaps by about 11:30 we'll be trending. But really, when I was reflecting about this, and I was thinking about this over the last couple of days and what it's about, and really what it's about is it's about our patients. And you know, when I say we, I mean every one of us here in the audience, when we deal with patients, and unfortunately when we have to give them a diagnosis of cancer, that patient is going on a journey. And really it's a journey that none of us want to actually go on. We don't want to go on it. We don't want to go on it ourselves. We don't want to go on it with our families. But you know, if we could do something to shorten that journey, if we could do something to make it better, well, I think we'll do a lot. You know, but if you think about it for a minute, but ultimately, if we could actually prevent patients from going on that journey at all, if we could prevent them, I think that's the ultimate aim. You know, and that's why we're here, and we're here to exchange information and to talk to people. And HPV and head and neck cancer, and you can see our key questions above there. I think there is a possibility that if we look at this and we look at it in a critical way and we listen to the experts, there is a possibility that in the future we might be able to prevent people going on that head and neck cancer journey. So with that and with that thought, I'd like to invite Professor Lokesh Joshi, and Professor is our Vice Dean for Research at National University Ireland, Galway. He's a leading light in the area of transitional research. His area is glycomics, I hope I pronounced that right, Professor. And he's originally from Rajasthan and came to Galway via Bath and Cornell and Arizona State University. Professor Joshi is also the Associate Director of the Centre for Bioanalytic Science. And we're very honoured to have him here, and I'd like to invite him to formally open the conference today.